Carry on my lecture with the clinical features, but previous to the clinical features or clinical signs, give you some terms about the malaria. Prepatent period. Prepatent period. Up to now, I gave you some words about the importance of protozoan parasites, about the malaria, importance of malaria as the protozoan parasites in the community, in the world, is the most important parasitic disease among the other parasitic diseases because of its more cases and more death, about the life cycle of the malaria parasites, about the host, and so on. Now let's move on the some terms and then clinical features, communication, transmission ways, and treatment maybe, and diagnosis. The first of them is some terms. The first term is prepatent period. What does it mean? The interval from time of infection until parasites become detectable in the blood. What does it mean? Means, suppose in this time vector female Anopheles mosquito bites the patient, bites the man, right? This one is biting time. Biting time. The parasite enters inside of the body, the tissue process, tissue schizogony. Then after tissue schizogony, enters in the RBC, and in RBC we can find the parasite in the blood. So the first time that we can diagnose there is malaria for this patient is the time that the parasite is inside of the RBC. For the first time we can see, but usually when patient comes us to diagnose the malaria parasite is not the first time that the parasite appears in the RBC. Why? Because there is no any symptom for the first time. I tell you how. So suppose this time the patient bited by the mosquito and the parasites are introduced inside of the patient until the first time we can see the parasite in the blood under the microscope. From the biting time until the observing the first time, for the first time, the parasite inside of the RBC is called prepatent period. Prepatent period, as you see here. Prepatent period. So if I ask you what is the prepatent period, you say from the first time biting until the first time observing or appearing parasite inside of the RBC. Appearing parasite inside of the RBC. What is the incubation period? Is from the first time biting until upcoming the symptoms. Upcoming the symptoms. What's the difference between the prepatent period and incubation period? Difference is here. When for the first time appearing the parasite in the RBC, there is no any symptom. After 2 or 3 times schizophrenia and reaching the number of parasites to the level of the appearing symptoms, this time is called incubation period. Incubation period happens later than prepatent. Incubation period happens later than prepatent. Usually, when we try to diagnose malaria parasites under the microscope, when the patient refers us with symptom, but prepatent period is before the symptom. Usually, we cannot find the prepatent period for the first time because there is no any symptom we see there is parasite inside of the RBC or not. But just you put in your mind that prepatent period means from the time, the biting time, until the appearing parasite inside of for the first time inside of the plant. So biting time, appearing parasite inside of the RBC. Incubation period, biting time, until you see the symptom. The patient feels the symptom. Symptom takes longer than time, the prepatent period. For the first appearing parasite in the RBC, there is not any symptom until 2 or 3 blood schizophrenia, until 2 or 3 blood schizophrenia, we can find the symptom. How long takes each blood schizophrenia? Depends on the sheep parasite, depends on the strain, the species of parasite. For example, for the Plasmodium vivax, 48 hours. 48 hours means within the 48 hours you have got one schizophrenia. 48 hours, one shot. Plasmodium vivax, Plasmodium falciparum, Plasmodium ovale. 48 hours. 48 hours. At the end of 48 hours, you see the symptom. You see symptom. Plasmodium malaria after 72 hours. 72 hours means 3 days. At the end of 3 days, starting 4th day, you see find the symptom. In Plasmodium knowledge, at the end of the 24 So, prepatent period after 2 or 3 schizophrenia, you see the incubation period. Incubation period. So, I told you 2 pairs. Prepatent period, incubation period. Prepatent period means from the biting time until the first time we see parasite inside of the RBC, incubation period from the biting time until we see the first symptom. Incubation time is longer than repeated period. Because for the first time of repeated period, we cannot see the symptom. So the patient does not refer us because there is no symptom. In morally, repeated period happens sooner than incubation. Okay. Right. Relapse. As I mentioned just last time, and you remember, among the 5 malaria parasites, Plasmodium vivax, Plasmodium falciparum, Plasmodium oval, Plasmodium malariae, and Plasmodium knapis. These are 5 species that infect human for malaria infection. Plasmodium vivax and Plasmodium malariae, these both have got relapse. I'm sure you can remember what's the relapse. If you remember, I told you when the sporozoites are introduced by the mosquito inside of the human body, some of them takes place for the normal time from the 7 days until 30 days, but some of them takes time longer, weeks or months, even years. The second one is called relapse. So, vivax and oval has got relapse. Relapse. In Plasmodium vivax and oval, some sporozoites with new name as hypozoite. If I ask you in the exam, what is the name, what is the hypozoite, you say new name of the sporozoite when they are take time, long time, take place in the liver cells for long time. In the liver from couple of weeks or couple of years. Then the agents start new tissue schizophrenia and blood schizophrenia if we do not treat the patient, because relapse has got different treatment than clinical treatment until you. Recrudescence, renewed manifestation of the infection due survival of erythrocytic form. What is the erythrocytic form? The form of blood schizophrenia. The next name of the blood schizophrenia is erythrocytic schizophrenia. The next name of RBC is erythrocyte. The next name of the blood RBC is erythrocyte. Erythrocytic schizophrenia means blood schizophrenia. So, recrudescence means renewing the manifestation of the infection because of survival of erythrocytic forms. This situation happens when we encounter with the drug resistance. The parasite has got resistance against the drug. form is called recrudescence. Recurrence is the same name of recrudescence, manifestation of the infection following treatment, but we have got the parasite again because treatment does not affect reinfection, recrudescence, and recurrence. Both of them have the same name. Right. Clinical features. So, prepatent period, incubation period, relapse, recrudescence, recurrence. Don't worry about the recurrence, just these two terms. Prepatent period, incubation period, and relapse and recrudescence. Relapse because of the presence of the parasite, I mean hypnozoa in the liver cells. Recrudescence because of drug resistance. Very easy, very easy. So, if I ask you what is the reason of the recrudescence, you say because of the presence of the parasite in the blood, because of drug resistance. When we ask you what is the reason of relapse, you say presence of parasite in the liver cell. Alright. Incubation period is clear and prepatent is clear. Now, let's move on the clinical features of malaria parasite, malaria infection. Right. The first symptom is, this is just introduction here. The first symptom is cold stage. Here you can see cold stage. Yes. One of you make this good one. How I can do that, please? Sorry. Thank you very much. Oh, yes. Very much. Okay, here, cold stage. The symptoms of malaria happen suddenly. The patient is with breath, for example. He or she is in the class, talking with you, listening to the lecture, and suddenly feels cold and says to you, my friend, I've got cold, I don't know why. And the cold getting worse and worse and worse. And he says, I cannot suffer this cold. Let me I go home to take rest because I feel very cold suddenly. This is the first stage of the symptoms of the malaria infection. Takes about 2 hours. Headache, body ache, vomiting, and nausea. All of them happen in this stage. Cold stage is the first stage, takes time from 15 to 2 hours. Usually 15 to 60 minutes, but sometimes 2 hours. So maximum 2 hours cold stage. After cold stage, immediately the patient says, a few seconds ago I felt cold stage. No, I'm feeling hot stage. My body is hot and burning and headache still remain body ache, and upset. The patient becomes upset really, and sometimes the degree of the fever comes up to 40 Celsius, as you see here. And the patient has got vomiting, and unfortunately, in this time, the children's after the children's under the 5 years old goes into coma, and if we do not treat the children in this state, may die, most of them. So here is why the malaria is danger for the people, particularly for the children, because if they reach the 40 Celsius of degree, may die, some of them. We should treat the children as soon as possible. This stage takes time, maximum 8 hours. Fever. After that, patient says, no, I'm feeling better than before. No, my situation is getting better and better, but replaces the hot stage with the sweating. Sweating, a lot of sweat in the body of the patient. This takes time about 2 hours. Overall, 12 hours. One package of the malaria symptoms takes time 12 hours. These 3 items, symptoms, signs are called paroxysm. Paroxysm means attack of the malaria is paroxysm. If I ask you what are the paroxysm items, you say cold, fever. If patient refers you and says, last night I felt first of all cold, and then it plays the fever and a lot of sweating. I don't know why. You say, oh, professor in the class told us that maybe got malaria. So you send the patient in the lab for the first time for malaria. If somebody refers you because of the fever from the Middle East countries and African countries, the first suspect is malaria. So the first time, think about the malaria. If fail and refuse, go on the others infection. Right. So after sweating, the patient usually the patient falls asleep, and as I mentioned, entire of them are called paroxysm, maybe 6 to 12 hours. All right. Right. Let's move on to complications. Move on to complications. Thank you. Thank you very much. Okay. Okay. Complication. Why? I told you Plasmodium falciparum is the malignant. Malignant is bad. Means danger. Malignant. Why? What is the malignancy of the Plasmodium falciparum? Most of the death happen because of the Plasmodium falciparum infection. What is the malignancy of Plasmodium falciparum that we encounter with a lot of death because of this malaria parasite? I'm going to give you some words about the malignancy of malaria parasite. Okay, you see this complication because malaria falciparum malaria has got some complications. That these complications make the falciparum malaria danger and malignant. Right? The first of them, there are some, but I give you 3 or 4 of them. The first of them is cerebral malaria. Cerebral. What does mean cerebral?
Cerebral?
Cerebral.
It's what?
It's brain.
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 So the first one, cerebral malaria. Very dangerous. Very dangerous. What does mean cerebral malaria? Means Plasmodium falciparum on the surface of those orifices that have got falciparum parasite, I mean Plasmodium falciparum on the surface of these orifices, you find some organelles. These are called knobs. So, on the surface of those orifices that are infected by Plasmodium falciparum, you find some organelles. These are called knobs. Knobs are sticky. You know what does sticky? They stick together, right? Suppose this is the capillary. Moving blood from this capillary, from inside of all capillary, the blood is moving. And the patient's blood has got malaria, I mean Plasmodium falciparum parasite. They are sticky, so it sticks together and blocks the way. So there is no any exchanging between this side and that side of the blocked way inside of the capillary. If this phenomenon happens in the brain, you will see cerebral malaria. Means brain is going to lock down its function. So the patient goes under the coma form and will die very soon, within 4 hours. If you see the patient has got Plasmodium Plasmodium falciparum malaria, and he's going to sleep in the normal time. You say, what's the problem about you? He or she says, I don't know why I'm going to sleep. You see, he or she is going under the coma form because of malaria falciparum, and after 4 hours, you will see die. So you should try to treat the patient as soon as possible. So one reason of the malignancy of Plasmodium falciparum is cerebral malaria complication, as you saw here. Blockage of the capillary, patient goes under the coma form and encounters with death, should be treated as soon as possible. Is it clear for you? The second one, hyperparasitemia. What is this? Plasmodium vivax attacks to the young orifices. Young orifices maximum are 2% in the blood. Plasmodium malariae attacks all orifices. These orifices also 2%. Suppose all of the young orifices are infected with the Plasmodium vivax. How much blood are infected? 2% maximum. Plasmodium malariae, old one, 2%. But Plasmodium falciparum attacks to all of the orifices, young, normal, and old. Means 10% infection of the orifices with the Plasmodium falciparum is normal. Okay? If you see the patient's orifices, 10% of patient's orifices has got Plasmodium falciparum, means the patient is going the direction of death step by step. 10%, one step. 50%, second step. 30%. So more than 10% infection of the RBCs encounters patient with death step by step. Should be treated as soon as possible. So this complication makes the Plasmodium falciparum malaria malignant because of hyperparasitemia, as I explained. Clear? The third one, renal failure. Renal is kidneys failure. In malaria parasites, some patients has got renal failures, means the body, this immunity system of the body produces antibody against those RBCs that have got parasite. And as a result of this antibody ruptures these RBCs, and these are going to be excreted from the kidneys. The nephrons cannot suffer because of the high level of hemoglobin and something like this. So the patient encounters the nephropathy. Nephropathy means blocking the kidney activity, kidney function. So failure. This problem is called, scientifically, is called black water fever syndrome. Black water fever syndrome. In this situation, patient should be go under the dialyzing process. And if you treat the patient as soon as possible, make the kidney, the renal, get some of them functions. But if not, the patient loses the kidneys and should be replaced with the new conductors. So I was 10 years ago as an advisor of WHO in the Sudan for teaching malaria there for 1 month. I saw some children that they had black water fever, and unfortunately, within 1 month that I was there, died some of them because of black water fever. So it's very important for the malarious patients. The fourth one, hypoglycemia. This problem happens among the pregnant ladies. So this is very important for you, for that you are future practitioners when you encounter with such problem. The hypoglycemia happens among those ladies that are pregnant and they have got malaria. 8% of them may get hypoglycemia. Is very dangerous for the pregnant ladies and their embryo. So should be treated as soon as possible. Acute respiratory insufficiency, pulmonary edema. 3 to 10% of those patients that have got Plasmodium falciparum infection may get this acute respiratory insufficiency and encounter with the death should be treated as soon as possible. Hyperpyrexia, I mentioned already, those patients that have got fever more than 40 degrees Celsius, particularly children less than below the 5 years old, that they encounter with the death if we do not treat them as soon as possible. So these 4 and some others, but these 5 are most important than others. Encounter the patient with this if we do not try to treat them as soon as possible. Transmission ways. Okay. The main and first way for transmission is Anopheles mosquito biting, as you see here. So the main way, normal way for transmission of malaria parasites is Anopheles mosquito biting. Second one, placenta in pregnant ladies. Transmitted malaria parasites by placenta from the mother to the the embryo by the placenta and makes the embryo embryo and dies embryo because of the malaria infection here. Blood transfusion is the third one. The third problem in the transmission way, in the blood bank, you can find this one. If they do not ask from the donor that did you get malaria or not, and they have malaria even in very, very low level of parasitemia. If they give as a donor the blood in the blood bank and transmit this blood to the other people, for example, they are under the surgery or something like this, maybe they get malaria as a result of this process. Other ways, for example, we culture the Plasmodium falciparum in Tehran for our students. They need for their thesis to work on the malaria parasites, particularly Plasmodium falciparum. If they do not wear the gloves and something like this and works with the culture means parasite is there, maybe they get, so they should be they should be careful about their work. And other ways, for example, making the slide from the patient or something like this. Okay, this is the life cycle I told you about that. These are the kinase. Those are in the stomach, inside of the stomach of the flies. Mosquitoes. You saw. This is the stomach of mosquito. You see here, all of them are oocysts and full of the sporozoite. Each of them, for example, 1, 2, 3, 4, 5, 6, all of them, inside of each of them, thousands sporozoites. This is under the normal, conventional microscope, This is under the electron microscope. These are the cells, the infected cells, and these are the sporozoites immigrating, going out from the oocytes and immigrating to the salivary gland. These are in the salivary gland. The parasites are in the salivary. These are the black one is nucleus. The others cytoplasm. These are the sporozoites inside of the salivary gland of the mosquito. This is the schizont inside of the liver cell. As I mentioned in the life cycle, at the end of the tissue schizogony, you have got the schizont, but tissue schizont full of the merozoite. This is full of the merozoite here, as you see. Entering merozoite inside of the RBC. It starts from here, then takes place more than before, and eventually takes place inside of the RBC and starts to start to go under the propagation or multiplication form. This is inside of the mosquito stomach, abdomen, stomach. This is the microgametocyte. I mean, male gametocyte is going to be divided into microgametes or male gametes. This process is called exflagellation. Exflagellation means dividing the microgametocyte to microgametes. This is a slide from the blood of the patient, one patient. These are the white blood cells. 1, 2, 3, 4, 5, 6, 7, 8, 9. 9 white blood cells. But all of these are the parasite. Plasmodium falciparum nucleus. The black one is nucleus. Nucleus, nucleus, nucleus. And full of the, unfortunately, full of the Plasmodium falciparum. More than 10% here. More than 10%. He has got cerebral malaria, is in coma form and should be treated as soon as possible. And heart has got hemorrhage as a result of malaria here. Those patients that goes under this situation will die very soon because of stopping the function of the heart, as you see here. Infected liver of malaria parasite, blood of the liver, you see, this form happens because of the pigments that I tell you what are pigments in the diagnosing situation very soon. Right. Let's move on the diagnosis of malaria parasites. Before diagnosing malaria parasites, I tell you about the treatment of malaria parasites, and then I will go to the diagnosis of malaria parasites. I put here, and this one here. If you want, you can rest just 5 minutes, because for 5 minutes I tell you about the malaria. 5 minutes. If you go outside, please come back within 5 minutes.
Okay.